Hello, my name is Daniel Portillo. I'm a PhD student in the Medical Design Innovations Laboratory at the University of Texas at San Antonio. Recently, some of our research has been focused on mitigating the complications that are typically caused by intravenous therapy. We've created a device to help with this, and we've dubbed it the IV Patency Monitoring Device. Before I proceed, I would just like to warn you that there are some images in this presentation that may be disturbing to some viewers. I would like to draw your attention to the fact that there are over 200 million IVs placed every year in the United States. Research has shown that up to 30% of these IVs enter a hazardous state, such as occlusion, where the catheter or vein becomes clotted, or extravasation, where the catheter slips out of the vein and into the surrounding tissue. Each of these states can lead to a variety of complications for patients, such as patient discomfort, phlebitis, bloodstream infections, deep vein thrombosis, tissue necrosis, and, in the case of a patient needing a life-saving IV fluid, death. So the solution is to create a device that monitors an IV during use and notifies caregivers when the IV becomes hazardous. We want this to occur in real time, and we also want our device to easily integrate into the existing IV system. Preliminary research conducted by our collaborators showed that if they introduced a pulse to the IV line, that they could actually detect it in a vein, but only if the IV was patent. Now, what this means is that if the IV was clotted or had slipped out of the vein, they weren't able to detect the pulse that they were sending through the IV line in the vein. We capitalized on this finding, and instead of monitoring the vein, we hypothesized that we could actually monitor the fluid in the IV line to detect the change in state. This is a demonstration of how our device works. The linear solenoid fires and impacts the IV line, sending vibrations through the fluid. There's a vibration sensor to the left of the linear solenoid that detects the vibrations within the IV line. This video shows the signal being generated by the vibration sensor as the linear solenoid impacts the line. As you can see, we're sampling at a very high frequency in order to capture the vibrations. We decided to evaluate our device in three different scenarios: the normal flow, which is where the IV is properly inserted into the vein; occlusion, where the IV is inserted into the vein, but we placed a hemostat on the phantom vein in order to simulate a blood clot; then the extravasation test, which is where the IV needle is placed into our phantom tissue next to the vein. And as you can see over time, the IV fluid that we were administering began to pool up on top of the hydrogel. Now, in a human arm, it actually stays within the skin and can lead to patient hazards such as this. The peak values captured by the vibration sensor were organized into kernel distributions for each scenario. What we can see is that the average analog value produced by the vibration sensor in the normal or healthy state was higher than either of the unhealthy states. There wasn't much distinguishability between the unhealthy states, and there was some overlap in the data between the healthy and unhealthy data sets. So what we believe is that while this could be an effective method, it may not be the most effective method. In order to gain a better understanding of how the IV fluid was being affected by the pulses we were generating, we connected a flow sensor inline to the IV system. This data shows that there was little distinguishability between the healthy and unhealthy scenarios. However, if you zoom into this window, you can see that we did get some statistical difference between the extravasation and occlusion and normal flow scenarios. Now, what all of our data shows is that the flow within the IV line does change depending on the patency or the state of the IV itself. We are planning on further evaluating some of the variables in our testing setup. For example, we want to evaluate different flow rates in the vein and the IV, as well as different sizes of catheters. We conducted some pilot in vivo rat studies. However, the data was inconclusive, and we believe it was due to the fact that the artery we were using was almost identical in size to the catheter that we were using. As far as the device goes, we are currently in the process of incorporating infrared sensors to detect the flow characteristics within the IV line. We are hoping to further reduce the size of our device to an embodiment that simply clips onto an existing IV line. We would like to thank the Department of Cardiothoracic Surgery at UT Health for collaborating with us and funding this research. I would like to thank members of the MDI lab that helped conduct this research, and if you have any questions or comments, we would love to hear from you. So please feel free to email us or visit our lab website at mdi.lab.utsa.edu. Thanks and stay safe.